I'm Dr. Gordon Schiff. I'm the Associate Director of the Brigham and Women's Patient Safety Center HIT CERT. And I'd like to talk about some exciting and important work that we've been doing under the aegis of the CERT, particularly to monitor patients and help patients in terms of side effects of medications. The project that I lead is one where we reach out to patients who've been newly started on medications for one of 4 common medical conditions. We're looking at people who get new medicine, newly started on a medicine for hypertension, for diabetes, for insomnia and depression. These are conditions that very commonly physicians are reaching to order medications, but often we don't monitor these patients to see how they're doing once they're started on the medications. So we've created electronic solutions that are coupled with a live human pharmacist that are allowing us to screen for problems that patients may be having. So the way this works is when a patient is started on one of these medications, we automatically generate a letter, and if patients then are okay about it, we have them receive one of these automated phone calls that takes about 5 to 10 minutes, where patients are screened on the telephone automatically for a series of 8 different types of side effects or any other that they may be experiencing since starting the medication. Any of those that screen positively as yes are transferred to our live pharmacist, who speaks both English and Spanish. And this is a service that the patients have told us they really appreciate, receiving these calls, the concern that's embodied in this outreach, and seeing how they're doing once they're started on the medication. As I mentioned, they receive a call at 4 weeks, and then they receive another call at 4 to 6 months after starting the medication. So anything that happens in the short term acutely, or even some medium term side effects, hopefully we have the potential for picking these up. And it turns out many of the adverse reactions we're detecting would otherwise go undetected. The patients often don't consider them, they don't report them to their doctor. One of the more interesting findings is that 44% of the patients in our study who are experiencing side effects, which by the way is occurring in about 1/3 of the patients, they're having some sort of symptom, and of those who are, 44%, or nearly half, have stopped the medication but have not told their doctor. So let's think about what this means. I'm a physician. I keep writing for the drug to be refilled. Maybe the patient is refilling it, but they're just not adhering to the therapy because of concerns about side effects on their part. This is obviously very costly. It's probably very unsafe in the sense that maybe patients need a medication and they're not taking something, or they may be renewed for a medication that they really don't think it's causing a problem for them. So this system, in a way that physicians don't really have the time to call every patient after we started the medication, or we even don't have enough pharmacists to do this kind of work manually. But using these automated solutions, we're trying to reach out and screen patients, and doing this kind of surveillance. We're not only learning about individual patients and being able to help them, we're also learning about new drugs. So an earlier part of this project that was the part of the CERT-HIT was actually looking at brand new drugs introduced in the marketplace. And we've looked at a series of drugs. When they got one of these new medications, we put one of these outreach screening phone calls, and we tried to see what the frequency of problems patients are reporting. And interestingly enough, many paralleled what we knew in the pre-marketing studies, but we found a number of side effects and that are occurring in frequencies that were more often than the pre-marketing studies. For example, a new drug for smoking, helping people stop smoking, was causing patients to have fatigue and depression, and even hallucinations and sexual problems that had previously been not reported, at least in the frequency that we were detecting. So this is an important contribution to understanding these medications and ensuring their safety. A final project that we're doing collaboratively with all the other CERT centers currently underway is to try to put in a project to help with education of young physicians about how to properly and safely and carefully prescribe. This is going to be introduced in the curriculum of all the medical schools across the country, because it's being done in collaboration with the medical education accreditation bodies. And what we're hoping to do is develop a curriculum for something that really has never been formally taught to young doctors in training, The doctors are going to be learning how to prescribe safely. What are some of the principles for when to start a drug, which drugs to choose, how to monitor patients, how to avoid patients' requests when they come in just to see medications advertised so they don't overly prescribe, how we prescribe much more cost efficiently. And these are all principles that we think need to be taught, and they need to be taught by thoughtful people who weigh the risks and the benefits of the drugs, not someone who's trying to promote the use of a drug. So this is, again, another exciting project. It's a collaborative among all the CERT centers, along with medical educators to improve training in drug prescribing and use.